Welcome. I'm Leslie Canham.
I'm Mary Gavoni.
I'm Linda Harvey.
I'm Olivia Wan, and together we are the Compliance Divas.
Welcome to this special edition of the Compliance Divas podcast. This is Linda Harvey. I'll serve as your moderator today, July 9th, 2021, as we discuss the Food and Drug Administration's recent revocation of the Emergency Use Authorization for KN95 respirator masks. The Compliance Divas bring clarity and simplicity by navigating regulatory compliance to keep you on course. Please subscribe to the Compliance Diva podcast through your favorite podcast channel or on our website at thecompliancedivas.com. Resources mentioned during our podcast can be found on the Compliance Divas website, and we welcome you to submit questions to the support@thecompliancedivas.com. That's support@thecompliancedivas.com. 2020 was a year of significant changes, personally and professionally. Now, even though we have over a year of COVID experience behind us, our work lives continue to change because of COVID. This is such important breaking news. Let's jump right into our conversation. Mary, can I turn to you first and ask you, could you share with our listeners a little bit of the background on the Emergency Use Authorization, sometimes called EUA, and what it is and what it meant for healthcare?
Absolutely, Linda. I think one of the things that we have learned during the course of the pandemic is how important the Food and Drug Administration is in dentistry, although I'm not sure that everybody has that understanding. But when face masks and respirators were in such short supply in the beginning of the pandemic, there was such a crisis with, as everybody knows, people being hospitalized and the hospital healthcare workers needing that respiratory protection. Those resources were given to the hospital workers, and even they couldn't get enough of them. And so what the Food and Drug Administration did was allow importing of different types of respirators from China and other countries that had not actually gone through our NIOSH, National Institute of Safety and Health approval process, and hadn't been cleared by the FDA for use as medical devices, because it was sort of any port in a storm. You know, we needed respiratory protection and we needed to get it from somewhere. And so these KN95s are an equivalent type of respirator, but they haven't been proven for efficacy through NIOSH. So the Emergency Use Authorization allowed them to be imported into the country, sold as medical devices during the crisis of supplies, our supply shortage, and it was only meant to be a temporary fix until the N95 respirators could be readily available, and that has now happened. So we're not in a critical supply shortage anymore, although some people still will share that they are having trouble getting large quantities of N95 respirators. But the KN95s should not be used in healthcare settings anymore because they are not approved through NIOSH, tested for efficacy. They have not been cleared by the FDA for use as medical devices now that that EUA has been revoked. So we saw through the course of our pandemic and various reports from the Food and Drug Administration that some of the KN95s that were imported into the country that were initially sold for use were tested, sample tested by NIOSH to see if they were effective, and they were found not to be. So then not only did we have a list on the FDA of approved KN95s to use under the EUA, we had a list of counterfeit or non-approved at KN95s to use. So I sympathize, empathize with all the practices out there that are confused about these KN95s, because it has created all kinds of craziness for us in dentistry and healthcare in general.
Mary, that's such a great recap. And I love how you wrap that up with the word confusion, because even among ourselves last year, we had confusion trying to sort everything out. And that's what we made a point of specializing in, confusing, so we can bring that clarity and simplicity to our listeners. And also, it was a temporary solution last year. And I think many offices didn't realize it. And it became a habit to have the KN95 respirator mask. And because it became that habit, it seemed like the new norm, but it's not the new norm. And actually, as I said in the very beginning, our norm is shifting because our professional work lives are continuing to change. What I'd like to do now is take a step step back at a higher level. And Leslie, I'd like to ask you to remind our audience about the different types of masks that we really learned about last year. Life was a lot more than just a level 3, wasn't it?
Absolutely. Linda, we were always confronted with level 1, 2, and 3 masks, but it surprised me that prior to COVID, a lot of folks didn't know the difference between the level of masks. I was actually first made aware that we were going to have a very serious problem when I put a request into my supplier, who provides me with a level 1, 2, and 3 mask for my clients and audiences. And one of the exercises that we had performed during our training session was to have people don a level 1, then a level 2, then a level 3 mask, and discern the differences between a level 1 and a level 3, for example. Over the last 5 years or so, again, pre-pandemic, I would get phone calls from various dental workers, particularly hygienists, who were asking about level 3s. They had not been introduced to level 3s, yet they were hearing that this was a better mask to wear for procedures that had higher levels of aerosol, such as using an ultrasonic scaler. And sometimes I'd even get a request for documentation to this effect, so they could bring it to their employer and get those level 3s ordered. Well, I was made aware that there was a pandemic when my supplier said, Leslie, we're not going to be able to send you the sample of the level 1, 2, and 3 masks because they're really being diverted at this time to China. And that was the first week of January in 2020. The difference between the level 1, 2, and 3 mask, and bear in mind that 95% of dental aerosols are 5 microns or less in diameter, and of course we can't see them. But the levels of mask, the filtration efficiency, a level 1 mask is about 95% bacterial filtration and particulate filtration efficiency. It's really a good dust cover. That's what I like to say, is that it really, it's a good thing to use if you're trimming a model in the lab, but not necessarily as good when you're performing procedures at a dental chair side. Level 2 and level 3 mask is bumped up to 98% bacterial and particulate filtration efficiency, whereas a level 3 has better moisture efficiency. And hence, that's why I was getting calls from hygienists who wanted that better moisture efficiency. So the difference between the surgical face mask and, of course, the N95 respirator is that an N95 respirator is going to reduce someone's exposure to particles, including very small particle aerosols and, of course, large droplets, which is what our surgical face mask is designed to do. The more fluid resistant it is, would be the higher type of, or the level of mask that you would want for more aerosol generating procedures. They have a lot of moisture. And it also, surgical face mask against large droplets. That's really where we were best protected. And I remember one year being at the OSAP meeting, there was a speaker who was talking about masks. And I remember getting very upset as I was listening to the lecture, because he said that the mask does not protect you very well against very small viruses. And I thought to myself, all these years I've been lecturing on how well a surgical face mask protects us, and how it needs to not have gaps in the bottom of the side and to really make sure it fits well. And here was this person kind of destroying all of my parts of my lecture with this. And then after I heard him out, I realized he was talking about the smaller particles, where, again, the surgical face mask, 95% to 98% bacterial filtration efficiency. Now, you take a look at COVID as a virus, SARS-CoV-2, it's measured in nanometers, and not micrometers, but nanometers. So there's a diameter of about 60 to 140 nanometers for SARS-CoV-2. It easily passes through even a well-fitting surgical face mask, whether it's a level 1, 2, or 3.
That is some amazing information. And I want to ask you just a few more questions just a second, but I'd like to jump in and make a comment real quick and say, it just reminds our listeners that all masks are not created equal. Anything else that you'd like to add to that, Leslie?
Well, yeah, actually, Linda, when we had the shortages last year, we were given a option of using what was called limited reuse of N95 respirators. And then we were given the option of what's called extended use of N95 respirators. And because of the shortages, that gave people a lot of comfort to know that there was some guidance. And this was not best practices. This is what was considered to be crisis capacity. That's where strategies can be used when supplies cannot meet a facility's current or anticipated demand for use. So extended use, we were told we could use an N95 approximately 5 times of donning and doffing. And that if we wanted to extend their use, we could wear them all day long and put either a surgical face mask over it, or we could wear a face shield. Now, as time went on, we learned that wearing a surgical face mask over an N95 was not a good idea. Dr. Michael Bell from CDC stated that wearing a mask over an N95 can actually compromise the seal. So if you were going to do that to protect the N95, so you could wear it all day from patient to patient, he suggested using a surgical face mask that ties rather than had ear loops. And so that was the extended use, to wear it all day from patient to patient, protect it with the face shield so that there wouldn't be a cross-contamination issue. The limited reuse was where we were told we could take it off at the end of the day and put it in a brown paper bag, not plastic, because it needed to air off, and let it sit for about 5 days, because that would allow the SARS-CoV-2 virus to air off. So we could wear it again for another full day. Now, of course, that was an emergency strategy. It's never a good idea to reuse a single-use disposable item, especially a PPE item, because we can compromise the seal as we're donning or doffing. The elastic strap could stretch and then no longer protect us. And where's the protection if we are not confident that it fits us well? So these limited reuse strategies and extended use strategies, again, were just during the year where we had no access to the right number of supplies to get us through our day. Today, that's vastly different, where not only can we get the supplies, but an interesting fact is that in California, the OSHA safety officers will ask a dental practice, if they're only using KN95s, claiming that they can't get N95s, they'll say, well, where did you go to get them? Where did you look? Where did you try to purchase them? Show me your efforts. And they also have on the Cal OSHA website a list of vendors who have a dedicated supply of N95s. So, interesting thing is that, yes, you can get them more readily, maybe not at the price that we want to pay, but we can certainly get them. And PPE is PPE. We've got to protect our workers. OSHA is concerned for the people who are potentially exposed at work, who are employees.
Yeah, we have to remember that many of our listeners are in different states, and they need to be careful and pay attention to the fact that they have an OSHA state-approved OSHA plan. They may not be able to wear KN95 masks anyway. One point I like to make is, sometimes these bulletins and these changes seem to come from nowhere. So Olivia, can you speak to us a little bit about how did the FDA go about alerting us? How did we know all of a sudden this deadline was coming?
Yes, I'll be glad to give a brief overview of the timeline, but I wanted to mention ahead of time, as Mary said earlier, that we do sympathize with our listeners, you dental hygienists, dental assistants. Remember, the Divas were once either a dental assistant or hygienist or both. So we understand the challenges you face, as well as the office managers listening and the dentists. Dentist, you're the ones paying for all this stuff. So we realize it's frustrating. And the rules and guidance change so frequently. As professional consultants, we have never in the history of doing this have seen such frequent changes. So we look back at this timeline, Linda, that as of April 3rd of last year, the FDA issued what they call an umbrella emergency use authorization for certain filtering face piece respirators that are manufactured in China, which we refer to as the KN95. These masks are not approved by NIOSH, which is the National Institute for Occupational Safety and Health, which is like a measuring stick, so to speak, for quality and performance of the United States standard. So the respirator models under the EAU were listed in the Appendix A. But what the FDA and NIOSH learned is that some of the respirators did not meet expected performance standards. So it was a false sense of security. And as a result, the FDA revised and reissued the EUA on May 7th of last year. And then last fall, the FDA reissued the EUA for non-NIOSH approved disposable filtering face piece respirators manufactured in China to authorize them only for emergency use, limited to those that were listed on the Emergency Use Authorizations Appendix A. And then moving into 2021, June 30th of this year, FDA announced revocation of the emergency use authorization because there were now adequate supplies, as Leslie so well pointed out. So no longer would we use these KN95s or attempt to decontaminate them, no extended use. And then breaking news, and this is why we're doing this podcast, is that effective July 6th, all models were revoked on the umbrella emergency use authorization list. So we should no longer be using the KN95s, which has caused a lot of confusion. We're getting support calls where people are calling in and saying, well, with the emergency temporary standard, we don't have to wear the respirators anyway. So we're having to direct people's attention back to the CDC's guidance for dental settings. Remember, folks, the emergency temporary standard was issued for healthcare, whether it's a podiatry practice, a nursing home, a medical clinic. So our unique environment involves aerosol generating procedures. And as Leslie pointed out, we should be looking for supplies of N95s and meet the compliance demands. And so we think that for dental teams, they should evaluate their inventory and make sure they're not using the KN95s any longer. What will you do with those supplies? Well, you could donate them to be used in third world countries, or they could be used for other applications, but they cannot be used for the purpose of a filtering face piece respirator. I hope that helps, Linda.
Oh, yes, it does, Olivia. And it's amazing because when you think about the changes and processes and the workarounds that were implemented last year, those were temporary solutions. And so anyone that's become to rely on those solutions and think that it's going forward, we can't do that. It's just absolutely changed once again this week. So Leslie, what else can you add to this, please?
Well, one suggestion that has come up is that we might store them in the event that we have another surge. And it's possible that we could face another shortage. So the KN95s might be a backup plan, a plan B. And that was another thing I forgot to mention earlier when we were talking about the crisis capacity. Another strategy that people were utilizing was decontaminating N95 respirators. I'm in California. California OSHA prohibits that decontamination process. They said you can do it, but you can't use them. Again, their position was you can do it for the purpose of stockpiling in the event of a future shortage, due to another surge. Now, Linda, one more thing I wanted to add is that there are differences between the N95 respirators that we can get for use in dentistry. We want to be sure that we're using a surgical N95 respirator, one that's designed for healthcare providers because it has more fluid resistance. And we want to avoid using N95s that are used, for example, in the construction industry, particularly the ones that have the exhalation valve, because that is not considered source control for us in healthcare. If you've ever taken a look at some of the, I guess you could say, a cross section of N95, there are some posters and some different images that show an N95 how it has these different filtration levels and different layers. And I always thought it was very interesting that the way that it captures the harmful particles that are very, very small is that one of the layers is an electrically charged layer that has fibers that actually attract these viruses and particles to it. And then there's other layers of filtration. Of course, we're wearing them tight fitting, which is another difference between what you might find with a surgical face mask versus an N95. And of course, there's different levels. They have N95, N98, N99, and different levels of resistance.
Thank you for that important clarification, Liz. I appreciate that. Mary, let's circle back and discuss how these changes have impacted dental teams and what are one or two things that a team should look at doing next so they can be in compliance with this new directive.
Absolutely. Of course, now that we have all of our listeners' heads just sort of swimming in all this information about KN95s and N95s and so forth, what most of you really want to know is, what does this mean for my practice? What do I do now? Well, number one, I think, is that all of us in dentistry, as I think I said earlier, need to understand the importance of FDA regulation for using devices in conjunction with patient care. If something that we use, and I'll use a common thing that we see, a dishwasher that you get at Best Buy and you install in your instrument sterilization area for cleaning instruments. That is not an FDA cleared device. It hasn't been approved as a medical device. It should never be used in conjunction with patient care. That becomes a risk management and a liability issue. And that's just one aspect of it. Now we look at the issue of respirators or even face masks that, some practices are out there buying face masks on Amazon or other online vendors because they're trying to get supplies and good prices. You need to make sure that they are FDA cleared as medical or surgical face masks or surgical respirators, because they should not be used in conjunction with healthcare unless there's an emergency, and the FDA has declared the emergency over. So if you've got a stockpile of KN95s, and Leslie, I think your suggestion was brilliant. Save them, store them, of course, in a dry, cool place so they don't get damaged. But in case we do have another crisis, and that's possible given what's happening with the Delta variants that are surging. So it may be in other states. You may have a shortage. But one of the first things you need to do is go back to, as I think Olivia stated, the CDC guidance that still says that we should be using N95 respirators for aerosol generating procedures. And actually, so does the OSHA guidance that was issued in March, separate from that emergency temporary standard, the specific guidance we got from OSHA, and we'll put those resources on the Compliance Divas website. They still say N95 respirators. So call your suppliers, get them on order, get a variety of sizes if you can, because remember that they need to be fit tested, and employees, if they haven't already, need to have a medical evaluation to make sure that they are medically fit to wear an N95 respirator. So those would be the top things that you need to do, is start planning ahead. And remember that not only as of July 6th, the KN95s cannot be used, but as of June 30th, which is just a couple weeks away, the N95s can no longer be decontaminated for reuse, except of course that they can't be done in California at all. But know that you can't reuse them after that. So get them on order, get prepared, and have your respiratory protection program available and ready for employees. So one of the things I just want to mention very quickly is that the Compliance Divas has created a great fit testing training video. Many of you may try to outsource or go to some other entity to get your N95s fit tested, which may be very costly. It may be difficult to do, taking time away from the office, but someone in your office can be trained to do fit testing. You can purchase a fit test kit through your dental supply company. And if you go to our website, thecompliancedivas.com, you can see the training information that we have available for you so that you can do your fit testing in your practice.
Great resources, Mary. Thank you so much. And also thank you for reminding us that June 30th was the deadline for offices not to, they're not allowed to reuse and extend the use of a respirator mask any longer. Let's have a couple more wrap-up comments and thoughts from our other divas. Olivia or Leslie, other tips or suggestions that you have for our listeners? Olivia?
Just a reminder for our listeners to assess their inventory. So it's a great time to organize our supply closets to determine what is in place, what needs to be stored maybe for emergency use later, what has shelf life listed, so we can be conscientious of that and be certain that we have the appropriate, that's actually the language that OSHA uses, the appropriate personal protective equipment in stock and ready to use.
Perfect. Wonderful. Leslie, how about you?
Well, I want to share with you what happened to one of my clients in the early days of the pandemic when he went to order N95s. All he could find was KN95s. He went to Amazon, and when they got the box, they opened it up, and these N95s literally fell apart in their hands. So a big word of caution to be sure that you know what you're purchasing. He had paid a great deal of money for something he basically had to throw in the trash. They couldn't even use them as face coverings out in public because they were such poor quality. And the other thing I wanted to add, it was a pretty important message that was brought up earlier in this podcast. Exempt from the emergency temporary standard does not exempt a dental practice from being OSHA compliant and protecting employees. It's simply a guidance for healthcare settings for certain steps. We still need to screen everyone at point of entry. That's part of the condition of being exempt from the rest of those temporary standards. We still need to follow OSHA regulations, and it's very well stated in the OSHA guidance from March, again, which will be on our Compliance Divas website, what the PPE ensemble recommendations are. And part of that is based on the amount of the transmissibility in your own area, in your own community. So it's not a one and done thing. Each state is going to look at their areas of concentrated high levels of COVID. And as we know today, we're seeing hospitals now being overwhelmed, younger people being admitted, having worse illnesses, being on respirators. And we need to be vigilant. And I just want to, very quickly put out there that something I'm hearing from my dental practices is that a lot of the team members are declining to get vaccinated. We are so vulnerable working in dentistry, and it's not just the aerosols. At the moment, those aerosols for SARS-CoV-2 linger for as long as 3 hours. So please, everyone, let's protect ourselves not only professionally, but personally as well.
Thank you, Leslie. Divas, this was an amazing podcast with some extremely valuable, very important information on the changes for our listeners. And Mary, thank you for the reminder of the Compliance Divas training program that we'll have available on our website. And Olivia and Leslie, what great points about the timeline of the whole events and the tips for going through your inventory and your practice and planning for your PPE properly so you have the appropriate PPE. This was such a content-rich podcast that I encourage our listeners to share the podcast and listen to it multiple times in order to be able to digest all the different segments that we talked about today. The Compliance Divas bring clarity and simplicity by navigating regulatory compliance to keep you on course. Please subscribe to the Compliance Diva podcast through your favorite podcast channel or on our website at thecompliancedivas.com. All the resources mentioned today can be found on our website, and you're welcome to submit questions to support@thecompliancedivas.com. Thank you.